Advanced reproductive technology is really kind of a catch-all phrase for almost any infertility treatment. But the way I want to use it here is to explain some of the really interesting and cutting-edge things that are happening now with infertility treatment. So one of the sort of more basic things that's actually been going on for a long time is something called surrogacy. And this is done in a woman, for instance, that's maybe had a hysterectomy but still has ovaries and wants to have a child. IVF can be done, but since there's no uterus in the woman, the embryo can be put into a different woman where she can then become pregnant, carry the baby, deliver the baby, and then the original parents keep the baby. That baby is genetically the baby of the woman whose ovaries were present, even though the uterus wasn't there. So even though a different woman carries the embryo, genetically speaking, that baby is just the same as if somebody got pregnant spontaneously, as long as the egg is taken from that woman's ovaries. Now, surrogacy can happen even beyond that, which is more of an adoptive thing with donor eggs or donor sperm, and there's all kinds of different scenarios that can happen. But surrogacy basically is where another woman carries a pregnancy for someone else, and then that person then raises the child. Now, there's another interesting thing called ICSI, which is a technology in which sperm are injected into an egg. So IVF is done, but instead of just sort of putting the sperm and letting things happen, sperm can be injected into the egg. And this is great for men that have extremely low sperm counts because they can take the individual sperm and inject them into the eggs. That's something called ICSI. It's another really advanced technology. Now, one of the really cutting edge things that's going on now is that they can do IVF. The doctor can then take a biopsy of the embryo, and that can be evaluated genetically to see if certain genetic problems exist. So, for example, in something like muscular dystrophy, it may be possible to do IVF, have several embryos, do biopsies, and then only implant the embryos that don't have muscular dystrophy. So those are the kind of technologies that are going on right now, in which it's possible to really do some genetic diagnosis on embryos prior to being placed into the woman in IVF, and therefore embryos that have a healthier genetic makeup, that don't have a genetic defect, can be placed into the woman, and therefore someone that has, for instance, a strong family history of a certain problem, that's possible to be bypassed. So those are some of the exciting things that are happening in advanced reproductive technology.
Medtwice.com